Good evening, everyone. Welcome again to our uh, 5 o'clock edition of MIT Men in Training. And as your host, I am Craig, the certified recovery coach here coming to you live. And so today we're going to be talking about some mentoring factors that I believe is so essential to uh, every man that's maybe watching this or maybe experiencing it or may need to know some of the information that I'm about to share. And so this article, I want to give a prop out to Origin, origintexas.com. And this article is about how to learn problem solving skills in addiction recovery. This is a hybrid uh, session. And so let's get right into it without further delay. All right. And so the article starts off by saying getting sober is only one problem to solve in addiction recovery. It may be why people who start treatment only focus on quitting drug use or drinking have trouble maintaining their sobriety. Problem solving skills are valuable tools to learn and develop during treatment. It serves far more purposes than helping you avoid a relapse. Let's introduce some common barriers to destroy and share some benefits of learning problem solving skills during inpatient treatment to overcome them. All right. And so this is so important that we learn about some problem solving skills because a lot of people they have the tendency or the notion to believe that that's all they need is a detox and a 28-day period to have all the problems solved. And I'm here to share with you that there is more to a 28-day treatment. So it says some of the common problem solving barriers in recovery are denying there's a substance use problem and looking for faults while any type of recovery program. Or all right, and so it says learning problem solving skills can be a valuable asset in getting and staying sober. Men can benefit from these skills by learning how to brainstorm solutions and observe judgment about a potential solution until it's tested, right? And so you never know exactly what you're experiencing or the benefits of a program unless you have actually went through the test. Experimental therapies help men struggling with substance use disorders learn effective problem-solving skills while it focuses on immersive physical activities, including drama therapy, art therapy, and outdoor adventures. But what we want to talk about are common problem-solving barriers in recovery. Common problem-solving barriers and recovery. Many obstacles can interfere with your ability to start and sustain recovery. A negative attitude towards treatment is one of them. By identifying these barriers right away, you can learn how to minimize them and free yourself to accept help in your recovery journey. Remember, this is a mentoring session. This is an MIT Men in Training. And so a lot of men may be struggling with, there's a whole list of recovery and things that we may be facing, whether it be relationship, social addiction, whatever it may be. It's our duty as men to tackle these issues and face them head on and to discuss them openly. All right. And so it says common problem solving barriers in recovery. Number one, looking for faults in recovery. A person looking for faults with recovery might mention their own past attempts at getting sober. They might use other people's inability to stay in recovery as an example too. Their focus is on what doesn't work, and they assume nothing will work for them. And that is a flaw. I like to look at it as a flaw. If a person is constantly taking the focus off themselves and uh, putting the blame on something or someone else. That's something that we will have to learn how to uh, build upon and to reshape that frame of thought. All right. And so number two talks about feeling a sense of self-pity. An excessive sense of unhappiness over your addiction troubles can be a barrier to staying in recovery. You might only focus on yourself and not see what you share in common with other people, right? In recovery, you may mistakenly assume your situation is far worse than others or outside of your control. And so, with that said, oftentimes, if you've not been attentive to what someone else is sharing, you may miss the point. And you may, like the article say, you might say, well, that's some lightweight stuff, for that person. A person may be going through alcohol addiction. They may be in recovery for alcohol. And let's keep the focus on myself. And I might be in recovery for heroin addiction. And so it's befitting, it's unbefitting of me to look down or pass judgment on that person or say or dismiss their level of addiction or their level of consumption use and say mine is greater than that person. And in all reality, we're all faced with the same addiction. And so I remember a time I was in a therapeutic community and I was talking with my supervisor, and he says it was in a group, and he says one person would say, I ain't no addict, I ain't no junkie, because I don't use alcohol or I don't use drugs. And so the supervisor would say, well, you may not use alcohol or drugs, but you may have another form of addiction, and that could be adrenaline. It could be money, selling or distributing illegal drugs and things of that nature. He says, regardless, don't look down upon someone because they have an addiction, because in all reality, you all or we all was in the same jail cell together. So therefore, he wasn't no better than me, and I was no better than him. So therefore, never pass judgment on someone just because you may think their situation or circumstance is minute. Okay. Number three, let's talk about number three, overreacting to comments or criticism. You may feel defensive when people suggest you need treatment. You may get aggressive verbally or physically. You may argue that your emotional state has nothing to do with your drinking or drug use. Stress and anxiety can accompany any conversation about the need for recovery help. And we're faced with that issue quite often. We go out in the community and we talk to people who we feel that there is a need, and there is a need because of they may have overdosed and they may have been Narcan, and so we may offer some assistance. And they tell us, there is nothing wrong with them, and so our job is to offer them the help and to encourage them. But they might still be in a state of denial. Like I said, we're not here to pass judgment on them. We are here to help them. And so a lot of times people do overreact, and they may think you criticize them because you're saying, hey, I believe, this, residential treatment or IOP, some type of form of treatment is something that you should consider. And they might think you don't tell me what to do, and they might get all aggressive. And so that's when it's time for us to back off and let them decide on their own. Number four, denying there is a problem. Telling yourself or others that nothing is wrong with your drinking or drug use creates a large obstacle for recovery efforts. Your sense of objectivity may disappear. You may ignore the evidence in your life. Present in your life. You may ignore the evidence in your life, present and lost trust present in lost trust in relationship, inability to stay financially independent, loss of income, or health with legal consequences. Denying there is a problem. Self-denial is a big major factor that one needs when we talk about common problem solving, barriers, and recovery. And so we talked about four common problem solving barriers. And number one was looking for fault with recovery. Number two, feeling a sense of self-pity. Number three, overreacting to comments or criticism. Number four, denying there is a problem. And number five, let's talk about number five, seeing only one solution. Seeing only one solution. Thinking of recovery as one stay in a 28-day program might be your perspective now. You don't allow yourself to see a recovery solution as being composed of several elements. Your inability to accept other kinds of help or suggestion cuts off potential path for sober living. All right, and so we on Thursday we have what we call all recovery meeting, many perspective or many ways of getting sober, many paths to sobriety that we deal with. And so a lot of times a person may be closed off or closed-minded to any other solution, because a lot of time some people may need MAT. If you don't know what MAT means, that means medication assisted treatment, whereas they have tried all other options and therefore they may need a little medical advice and medical assistance from the professionals who will administer some type of maintenance, all right? And that could be Suboxone, Vivitrol, et cetera, et cetera. But that is totally up to the professional people to make that decision and the person who are willing to accept it. Number six, we're talking about common problem solving barriers and recovery. Number six is talking about ignoring mental health needs. This is so major. This is so major. And that's why it's important that mentoring or men share information, begin to be honest and open with one another, because a lot of times we have the stereotype, whereas we put up a roadblock, we put up this barrier when it comes to mental health and the need for medication to live a balanced, stable life. So people with substance abuse issue most of the times has an underlying mental disease, whether it be from past trauma, whether it be a chemical imbalance in the brain, or whatever it may be, whatever diagnosis or however you've been diagnosed, that issue is something that needs to be addressed by a professional. And it says, you have tried treatment programs more than once, but believe there is no connection to the state of your mental health. You may be aware of your depression, anxiety, or post-traumatic stress, yet do nothing to address it, right? You may have unresolved trauma that affects your sleep, right? Relationship and anxiety levels, and blame those symptoms on other people. When I was in college, I took a course on, it was dealing with substances. And one of the things that I learned is what they call masking. Most people, they mask that mental illness or the trauma that they may have experienced, depression or anxiety, whatever mental state it is. A lot of times people can't identify it, number one, and so therefore to cope with whatever they are experiencing or going through, oftentimes we mask it with either alcohol, misuse, drugs, misuse. And so therefore now you have not only the issue of substance use disorder or addiction, you also have the component of mental illness that haven't been addressed and need to be addressed. All right, let's talk about the benefits of learning problem solving skills for men. The benefits of learning problem-solving skills for men. And the article says the learning problem-solving skills is essential for both recovery needs and for life in general. The process should be simplified to help you take small steps towards a larger goal. You'll want to start by naming the problem and being as specific as possible. If a large problem is made up of several smaller problems, take on the smaller problems one at a time. And so it says when a person go into some type of form of treatment, and if they believe to have a dual diagnosis, mental health issue as well as a substance use issue, they cannot address the mental issue unless one is clean and sober. But they don't use the word clean. One is sober from the substance use, whatever they may have consumed, in order for them to treat the mental aspect. Once you isolated one problem to focus on, brainstorm to come up with a variety of possible solutions. You don't have to do the work alone. Look to trusted friends and family members to help weigh the pros and cons of each solution. When you're informed about possible consequences, it's important to decide how to solve the problem. Follow through on the behavior necessary to put the decision into action, and take note of the outcome. The solution may not work as well as you imagine or at all, but it's still a valid attempt and something for you to learn from trying again. Practicing problem-solving skills in addiction recovery provides numerous benefits. Let me read that again. Practicing problem-solving skills in addiction recovery provides numerous benefits. You'll learn how to approach a problem from different dimensions. You think about how the large problem is and how it might look to an outside observer. Now we're talking about your perception, how you view things, how you process a situation, right? You imagine how life will look once the problem is solved, right? From a positive perspective. Learning problem-solving skills encourages people to remain open-minded to all potential solutions. You'll get in the habit of letting ideas flow before immediately eliminating them. You may discover an idea evolves over time or gets combined with another idea to produce the solution you need. Examining the potential outcomes of each solution is a useful way to assess positive or negative consequences before you make a decision. Now you're using cognitive skills. Now you're processing any given situation or circumstance that you're facing. Now you're looking at it from, the article says, multiple dimension. And so you're looking at it from a two-pronged approach, positive and negative. So we want to utilize our positive aspect over the negative, all right? This helps you measure your choices differently. You can even begin to look at the probability of success from a specific solution. You can even begin to look at the probability of success from a specific solution. All right, success, that's the goal. We want to be successful in all of our approach and all our problem-solving endeavors. And so we're going to talk about this one right here. Experimental therapy should include problem-solving skills. Now, this is something that sounds very interesting. Let's see what the article talks about. Experimental therapy is an immersive approach to treatment for addiction and mental health disorders. Beyond talking, a person in experimental therapy may participate in role-playing, acting out events of the past, music, poetry, arts and crafts, and more. All right, by getting their body involved in the experience, it can open aspects of their emotional and psychological states. All right, experimental therapies can be a promising setting for introducing problem-solving skills in addiction recovery. Consider the potential problem-solving available in the form of drama therapy. Drama therapy is something very important. When I was in the therapeutic community, we used to do what we used to call we used to work on core curriculum, and core curriculum will be what we would talk about our core beliefs. And so when we used to deal with our core belief and how did we process our core belief over those outside influences, and we began to start processing, and then we began to make a better decision which one weighs more in favor of our outcome, whether it's our core belief or outside learning skills that we may have learned from the outside influences. All right. And so that is something that's very important to look at. And so we want to go on and says art therapy is another form with the potential for problem-solving skills development. A person is able to identify what challenges they face with the medium. They might have a little or no experience with sculpting or poetry. All right. They may need to ask for help with a drawing technique. A shortage or lack of material might prompt them to find a way to work around the issues. And so they also have what they call breathing exercise. They also have behavior modification, where you do the desensitization exercise, where you think of a calm scene. And so those are experimental therapies that one can also utilize as well, muscle relaxation, things of that nature. When people are given opportunity to engage with objects in their environments, this is much more in line with how their recovery needs will appear. Experimental therapy gives them a chance to practice these critical problem-solving skills while under the supervision of a therapist. What they learn about their strengths and limitations can shape how they express their recovery work indefinitely. And so last but not least, we want to talk about how to ensure your addiction center offers experimental therapies that are right for you. Experimental therapies are a valuable part of any addiction treatment program, and finding out what an addiction center offers is easy. You can call one directly and ask about experimental therapies that include problem-solving skills. Also, you can evaluate what an addiction center provides based on its website content. Experimental therapy is designed to be engaging and comes in a variety of forms. All right, and so this is something that people can request if that's something that you are interested in. But the goal here is to get men involved and to get men to open up and share and to face that which we may fear. And that is people knowing that we have a problem, and that regardless of what people may think or say, we know that it's up to us to face these problems head on, but with the idea and the hopes to have a positive result. And so that's why we're here today. That's why I'm here today, talking about how to learn problem-solving skills in addiction recovery. And so if you are out there and you are dealing with addiction recovery, come check us out. Be a part of what we're doing here. We love to have you. And so keep your head up and always take approach from a positive perspective. All right. And so that's it for me. And so you have a blessed day. I'll see you on the next time. 5 at 5, live at 5 MIT mentoring group. And so once again, I want to share this with you. If you know someone who needs help with any type of substance use disorder, please have them reach out, and have them reach out to that number right there that's scrolling across the screen. And that number is 856-391-7449. That's here in the office. And the hotline number is 1-800-236-2448. How can we help you with your recovery today? And what does recovery means to you? All right, that's it. So long. My name is Craig. I'm out of here.